In the posterior leg, we are able to see a series of superficial muscles. The first one we see is the gastrocnemius. It has a medial head, a lateral head, and it is converged into the calcaneal tendon along with the next muscle deep, which is the soleus. The soleus can be seen here, still attached up near the fibular head. This is the posterior of a right lower limb. Okay, and so we take this and reflect the soleus out lateral, and we can get a better view of the deeper structures. The next muscle deep has a nice long slender tendon it's called the plantaris. This one's been cut and reflected. Its head was above the lateral head of the gastroc. Pull that away. The deepest muscle of the posterior leg, you have to pull the neurovasculature apart, and we can see through some fascia here the popliteus muscle running obliquely across the posterior of the tibia onto that lateral condyle of the femur. If we look at the neurovasculature, what we're going to consider is that the sciatic nerve gives off a large nerve here called the tibial nerve coming all the way down through the leg. It does not change name. Deep to that is the popliteal artery. Actually, the popliteal vein has been removed in this specimen for clarity, but the popliteal vein would be the next deepest, and then the deepest of the three would be the popliteal artery. As we follow the popliteal artery past the knee joint's about right here. We come across the knee, we can see a large branch coming horizontally and disappearing rather quickly into the anterior compartment is the anterior tibial artery. This is where the popliteal artery naming stops, and then we have the rest of this artery called the posterior tibial artery, which parallels the tibial nerve down the leg. Coming off early off the posterior tibial artery is the fibular artery, which progresses over here to hide in deep to the flexor hallucis longus. If we come back up towards the knee, still inferior to the knee joint, which is about here, we can see two small branches that are tethered tightly to the tibia, and the posterior knee joint capsule is the inferior medial and lateral genicular arteries. Coming back down into the leg, posterior surface of the fibula, we can see the flexor hallucis longus where the fibular artery went to hide. We find deep in the midline the tibialis posterior muscle, and then deep on the posterior side of the tibia is the flexor digitorum longus. All three of those muscles, the tibial nerve and the posterior tibial artery, will progress to the medial side of the ankle behind the medial malleolus to run through the tarsal tunnel. We see a bit of flexor retinaculum found here. The perforating branch of the fibular artery would be found deep within this distal leg. We have not exposed that on this specimen, but that would be a branch off fibular to perforate through the interosseous membrane.